2022. Can we roll the tape, please?
Can you all see my screen?
Yes.
Yes.
Oops.
Due to COVID-19, this meeting will be conducted as a Zoom meeting pursuant to the provisions of Assembly Bill 361, which suspends certain requirements of the Brown Act. This meeting is being live streamed on the CCTA website. The chair will call upon members, staff, and other speakers by name. Please speak clearly and state your name before giving comments or remarks. Persons participating via Zoom with their cameras enabled are reminded that their activities are visible to viewers. Members participating by Zoom wishing to speak should physically raise their hand and unmute their mic when called upon. Members should mute their mics when done speaking. Citizens participating by Zoom wishing to speak should use the raise hand feature or dial *9 if participating via phone, and the chair or staff will call upon them at the appropriate time. Citizens will have 3 minutes to speak. After 3 minutes, staff will lower their hand and mute their mic. Participants via phone will be called upon by the last 4 digits of their phone number. It is requested that public speakers state their names and organization, but providing such information is voluntary. Written public comments received in accordance with the teleconferencing special notice for public comment guidelines are printed on the meeting agenda. If authors of the written correspondence would like to speak, they should raise their hand and the chair will call upon them at the appropriate time. All written correspondence received after that and during the meeting will be entered into the record. A roll call vote will be taken for all action items. Thank you for participating in a meeting of the Contra Costa Transportation Authority.
Thank you. And Jackie, with that, would you do roll call, please?
Yes, thanks. Member Barnes?
Present.
Member Burgess?
Burgess here.
Thank you. Member Braxton? Member Franklin?
Present.
Member Haskew?
Here.
Member Hudson?
Here.
Member Hirsch? Member Kamara?
Here.
Member Levin? Member McCrary?
Here.
Member Meyer?
Here.
Member Thompson? Member Toth?
Here.
Member Xavier?
Here.
Vice Chair Geringer?
Here.
Chair Mitchoff?
I am here.
Thank you. We have, oh, sorry, I was just going to say all members are present except for members Braxton, Hirsch, Levin, and Thompson. And we do have a quorum.
Thank you. And before I forget, I did see something, I think in the Supervisor Joya posted that Member Braxton has recently been honored for her many years of community service. Rita, I want to make sure I have that correct. Was it at a Richmond City Council meeting, or I'm looking to you as a West County person that may know more than
It was at a California Alliance for Retired Americans.
Okay, thank you.
Yeah.
And with that, we will go to public comment. Jackie, are there any members who wish to address us on any item not on today's agenda? There will be opportunity for public comment on agendized items.
I have not received any written public comment.
Okay, I don't see any hands raised. All righty. Well, we will move on to item 3, which is the election of chair and vice chair for 2023. Mr. Hale, are you giving this report?
No, Chair Mitchoff. I think we're just seeking a nomination.
And will I'm sorry, I'm going back and forth between the real agenda and then the one with all the stuff on it. So we're just taking nominations and opening them today, and the vote will be after the first of the year, or will we be voting today?
We will be voting today.
Okay, great. I would like to open the floor for nominations for, if you have nominations.
I'll do them both if I can.
Go ahead, Dave.
Yeah, I'll nominate Teresa Geringer for the chair and Loella Haskew for the vice chair. She always beats me to the second anyway.
Okay. Are there any other nominations for chair or vice chair from the body?
Can I second that? It's Debbie.
Okay, yes, that would be lovely. Thank you, Debbie. And I'm not seeing any other hands up. Before we vote, let's go to public comment.
No public comment received on this, and I don't see any hands raised.
Wonderful. There's been a motion by Member Hudson and a second by Member Toth to elect Luella Haskew of the City of Walnut Creek as vice chair and Teresa Geringer of the City of Lafayette as chair for 2023 for the Accessible Transportation Task Force. Roll call, please.
Member Barnes,
Aye.
Member Burgess.
Burgess, yes.
Thank you. Sorry. Member Braxton. Member Franklin.
Aye.
Member Haskew.
Yes.
Member Hudson.
Yes.
Member Hirsch. Member Kamara.
Yes.
Member Levin. Member McCrary.
Yes.
Member Meyer.
Yes.
Member Thompson. Member Toth.
Yes.
Member Xavier.
Aye.
Vice Chair Geringer.
Aye.
Chair Mitchoff.
Yes.
Thank you. And we have motion passes unanimously with members Braxton, Hirsch, Levin, and Thompson absent.
Thank you. Item 4 is our consent calendar. The only item on there is our summary of actions from our October 20th, 2022 meeting. Do I have a motion to approve the consent calendar?
Move consent, Hudson.
Moved by Hudson,
Second, Geringer.
second Geringer. Thank you. Do we have any public comment?
No written public comment on this item.
All right, let's have a roll call vote, please.
Okay, Member Barnes,
Aye.
Member Burgess.
Yay, yes.
Got it. Thank you. Member Braxton. Member Franklin.
Aye.
Member Haskew.
Abstain?
Chicken.
Member Hudson.
Yes.
Member Hirsch. Member Kamara.
Yes.
Member Levin. Member McCrary.
Aye.
Member Meyer.
Yes.
Member Thompson. Member Toth.
Yes.
Member Xavier.
Aye.
Vice Chair Geringer.
Aye.
Chair Mitchoff.
Yes.
Thank you. Motion passes. Oops, sorry.
No, I'm sorry. You're always so good. Go ahead and finish your comment, please.
No, I was just going to say motion passes unanimously with members Braxton, Hirsch, Levin, and Thompson absent, and member Haskew abstaining.
Thank you so much. Congratulations. You are in good hands in the next year. All right, moving on to item 5, which is our regular agenda items. Our first item is item A, which is to seek to get approval to proceed with the East County Means-Based Fare Pilot and authorization to execute agreement number 626 with the Contra Costa Crisis Center to provide administrative services to implement the program. And who from staff will be giving this report? Mr. Cunningham.
Yes, thank you, Chair Mitchoff. I'll provide a brief introduction before turning it over to the Nelson Nygaard team, who will get into the details. And my name is John Cunningham. I'm a transportation planner with Contra Costa County, and I've been supporting the Transportation Authority's effort on the Accessible Transportation Strategic Plan. And as you mentioned in the introduction, before you is a recommendation to proceed with implementing the means-based fare subsidy program. So this program was identified in the Accessible Transportation Strategic Plan, which we'll refer to either as the ATS plan or ATSP, it was identified as a priority project. This is due to the fact that the outreach to stakeholders, which was significant, indicated that the fares are a significant barrier to low-income populations getting transportation service. So as indicated in the staff report, the task force has actually seen this item before in April, I believe. We took that feedback and we developed the program further. And this is where I turn it over to the Nelson Nygaard team. We have Naomi Armenta and Alejo Alvarado on that team. And we also have Tom Tamara here from the Contra Costa Crisis Center. He and his staff, along with Tri-Delta Transit staff, were instrumental in helping us refine this program. So with that, I can turn it over to Naomi Armenta.
Thank you. I'm going to share my screen here. Let me know, does that look okay?
It does.
Good.
Thank you. As John mentioned, my name is Naomi Armenta. I'm with Nelson Nygaard Consulting, and I'm the project manager for our support in developing the ATSP and now implementing it. So we wanted to come back to you with the means-based fare pilot proposal. And as John mentioned, the strategy was included in the plan, and then as a priority activity for Measure X. We as a team reviewed model programs and best practices around the Bay Area. We presented those in April. We also tried to identify geographic areas with gaps in service. As we think about these short-term priorities that we are trying to implement, we want to make sure to include some geographic equity. Central and South County have already been involved in the one-seat ride pilot. We wanted to look at West and East County for the next pilot. Originally, West County was proposed for a subsidized PNC pilot. However, in June, this body identified several questions that would prevent timely implementation. We met as a planning team with Tri-Delta Transit to determine the feasibility of beginning the pilot in East County. And in those discussions, it emerged that an ADA mandated paratransit fare subsidy program would be more feasible and desirable. The ATSP did identify means-based fares for really all applicable modes: transit, paratransit, taxi, Uber, Lyft, car share, as necessary to fill critical transportation needs for older adults and people with disabilities who are low income. So the pilot programs are intended to help staff to collect important information relative to potential demand and implementation logistics in preparation for expansion into new geographic areas and modes. So some of the details for this particular pilot proposal: eligibility would be people with disabilities who are already determined to be eligible for paratransit with Tri-Delta Transit paratransit that meet what is called extremely low income criteria. So we are recommending that most strict low income criteria at this time to get started for the pilot, but there may be a time later on that we could have capacity for a less restrictive income requirement. The benefit would be that eligible riders would receive $22 or the equivalent of 8 one-way trips of tickets per month to use for local Tri-Delta paratransit trips. The service area and times would be the same as Tri-Delta Transit paratransit, and this program would not apply to the one-seat ride. The pilot duration we're looking at 6 months with review at 3 months, as in sort of a report to consider subsidy and or eligibility adjustments if necessary. So in terms of communication with potential participants, CCTA and county staff will develop outreach materials. And Tri-Delta Transit will help us distribute flyers or postcards to paratransit riders and display on vehicles. Customer service would be handled by the Contra Costa Crisis Center and much of the administration. So the inquiries would be directed to them. So they would help verify the ADA certification with Tri-Delta Transit, verify the low-income eligibility, provide tickets to participants, answer questions, and track inquiries. So how do we determine this low-income eligibility? Well, following some of those other best practices we looked at, we determined a number of participation in a number of these programs would indicate eligibility. So if individuals could provide us proof of their participation in this program, that would take care of it. We also have some options to request certain paperwork or financial documentation from them. So there may be other ways to be flexible about this as well. In terms of monitoring and then reporting on how the pilot is going, our team will work on that. And as much as possible, collect data on usage, demand, and costs. One question everybody has is this going to increase demand, either in rides or in registering for paratransit, period. So that is something we would be attempting to monitor. The fare media will determine some of our monitoring abilities. So if it is tickets, say of a specific color, we will really only have an aggregate knowledge of how many rides are happening. We won't know about individual rides, but we can also collect information from the Contra Costa Crisis Center, and we can also do a sort of follow-up type of monitoring where we reach out to participants and ask them to, voluntarily tell us a little bit about how the experience has been for them. So the staff recommendation is that we proceed with this pilot. The total budget is $100,000 using Measure X funds, as I stated, is a 6-month pilot. And then there's also a request that we can execute this agreement with the Contra Costa Crisis Center to provide administrative services in an amount not to exceed $20,000. That is a part of the $100,000 budget. And I should note that that's also, actually, this administrative portion is also something we're piloting. So we'll also be monitoring how that process goes for them as well. And with that, I would be happy to take any questions.
All righty. I'm looking for hands raised. Dave.
Thank you, Chair Mitchell. The first thing that came to mind when I look at this, and maybe it's I just don't have a handle on the whole thing, but we put $100,000 into something and 20% of it goes to administration. And it was just a concern, but the more and more I look at it, it seems like the job is administration. So maybe it's not, maybe I should not come to as many meetings. I mean, is there anybody complaining that more money should go for tickets or something else in the program, or is it just too early?
My answer would be that it is too early. There's a lot about this. We don't know how it's going to go yet. John, did you have an answer?
I guess, yeah, I did want to jump in on that. Thanks, Naomi. So part of this is also the administration. This is the very first program being rolled out as a part of the ATSB, excepting the one-seat ride program, which actually predates this effort. So some of this administration is a learning curve that we're gonna get out of this. So some might argue with the split between operations and administration. This is very truly a pilot. This is not a nominal pilot. We are learning both the operations end of things, what the demand is going to be, what the impact on latent demand is going to be, as we just talked about, and also admin, what the admin costs are going to be. We'll get more efficient as time rolls on.
Well, I have to tell you, John, the more I looked at it, I started saying, how in the heck you get them to do it for $20,000? But maybe we better be successful. The optics on it, when you first look at it, it's the first thing that jumps out at you. Then all of a sudden you go, well, wait a minute, we got to find out what the heck we're doing. And maybe
Thank you.
somebody thought there was another zero there, but anyway, good job. I'm not arguing about it. I just wanted to find out if I'm the only one that thought that way initially.
Thank you.
Thank you. Rashida?
Thank you. I'm glad one of these initiatives is moving forward with votes in lightning speed. I'm all about that. But the question that I had was, since one of the first eligibility criteria are individuals that are eligible for paratransit service, was it within that pool that you determined the other eligibility factors? Was it directly from data that maybe TriDelta may have provided you for you to be able to determine that at least for 6 months, a certain amount of individuals may already qualify for this, may take advantage of this, and may equal about 80,000 to spend on this for 6 months?
So TriDelta Transit does not collect their riders' income information. So what we did to determine our estimate was we looked at the population as a whole of older adults, and I believe people with disabilities as well. Sometimes those numbers aren't as solid, but we looked at that population as a whole, and what percentage of that population would meet the extremely low income criteria. And then we applied that proportion to the TriDelta Transit registration to say, okay, we think this many people would be interested or eligible, so then we think we could afford this many rides.
Okay, thank you very much for that.
Thank you. Debbie Toth?
Thank you. Can you hear me okay? I'm having some impressive technology issues.
Yes, we can.
Fantastic. So I think it was Member Hudson that was asking about the administrative costs being 20%. And I too look at that as a high level of administrative expense, but I guess I'm wanting a little more detail, and it could have been that I just didn't hear it because my technology issues are impressive. But what is the administration of it, and why 211 and not an expert in this population or this level of this kind of service? So I'll mute myself and let somebody answer.
So when we look at, there's very few programs like this already, but the ones that we look at are administered in-house by the transit operator. However, we of course hope that this as a pilot will be expanded beyond one transit operator. And also TriDelta Transit, like many organizations, is having staffing challenges and was really not in a position to take on the administration of a whole new program. But you know, they're trying to help us figure out the verification and the logistics and all of that just as well. And so we also looked towards Contra Costa Crisis Center because they are the 211 operator and they're used to fielding calls and providing services and linkages. And they're going to be part of our ongoing work with the ATSP in some way, since they are the 211 operator and we are looking to do a one call, one click. There is going to continue to be some level of communication or coordination there. So that is how we came to the decision to work with them on this pilot.
If I could add just a bit more onto that as well. Thank you, Naomi. Also, the Contra Costa Crisis Center and Tamara specifically was engaged throughout the ATS process. So he's coming in and the organization is coming in well informed on what the mission, what we're trying to accomplish here is. And you alluded to it, Naomi, but I believe that there's precedent for this in that I believe 211 in Alameda County provides, helps out in the transportation realm as well. The Venn diagram of the population that they work with, there might not be an overlap, but complete overlap, but there is some overlap in their mission at least. So thank you.
Debbie, does that answer your question?
Answers my question. I don't know if I'm satisfied.
Oh, I know.
I guess what I would want to see, because this population we know that's riding paratransit is been typically certified by a physician to be functionally unable to take the fixed route transit, has a variety of specialty level of need. And I'm personally not comfortable with 211 not having some training around this population, at least first. And I think that the area agency on aging's information and assistance line has socials that fields calls all day long, Monday through Friday from 8 a.m. to 5 p.m. of this population that has specialty in that. And I'm not saying you should go with them, but I'm just saying there are other places and spaces that have specialty experts in this population. And so I would either ask that we have a little bit of further conversation about this, because this is, to me, and I'm sorry, but it's the same as sending somebody who's 85 years old to a general family practitioner who doesn't have experience in gerontology, and the body responds very differently to medication and disease processes as it ages. So having that specialty is incredibly important. So I just want to throw that out there. Maybe it's a training opportunity and not a different entity opportunity. I have nothing against 211, just stating that doesn't have the expertise in this population. And I'd like to see something done about that. That's all.
Okay, thank you. Susanna Meyer?
Thank you, Chair Mitchoff. First, I'd like to echo what Debbie said. I think she's got some very good points around that response. But I would also like to say, as an East County resident, that I'm very happy to see this resource, even on a pilot program level, coming to East County. There's a lot that still needs to be done to build resources out here. But my question would be around the outreach. I realize that this is going to be an available resource to people who call 211, but how do we get the word out to the people that don't know about it, that don't typically call 211? Do we work with cities? Do we work with hospital discharge planners? I mean, what's the plan around that? Thank you.
Okay. And John, did you want to take that question? I'm looking at slide, I guess it is 4. But I think what Suzanne is asking is for a little bit more in-depth information.
Yep.
Yes, thank you.
Good question. This is something that we discussed internally. The target population is fairly narrow and fairly well defined. The population is Tri-Delta Transit, ADA paratransit registrants, those that have already been certified for service with Tri-Delta Transit. Tri-Delta Transit in our meetings has already agreed to broadcast the service to that population. Broadcasting it above and beyond that is also possible, and we're going to work on what areas we can send out the marketing material, the program material to as well, senior centers, that sort of thing. So we do have a fairly detailed plan, and again, it is a fairly narrow population that we're promoting the program to. So I hope that answers your question, Suzanne.
That does. I'm glad to hear that there's more discussion happening outside of what was in the slide. Thank you.
Thank you. Carol? You need to unmute yourself.
Sorry, I was farther down. I thought I was farther down the list. I looked at the 20% administrative costs as kind of a startup process, that there will need a lot of systems to be in place to organize and collect data. And that way, I would hope that ongoing, if this continues, that it wouldn't be more than 15% administrative overhead. I also appreciate Debbie's comments about training 211 staff, and even Tri-Delta staff in some cases, to offer the challenges with senior citizens and people with disabilities in East Contra Costa County. I'm glad. I'm sorry Richmond isn't the pilot project. But I'm glad it's Tri-Delta because that area is very, very lacking in serving people that are wheelchair users. We often wait months for somebody to get a ride to our services. So I'm glad about that. Thank you.
Thank you. And I am going to, I see both Rashida and Debbie still have their hands up. I'm going to go to them, but eventually, Mr. Tamara, I'm going to come to you because I think there is valid concerns over training, and I'll look to you to see if you can address that and or other thoughts. Rashida, go ahead, please.
Thank you. The question I had is also in relation to what Debbie said. So if they're going to be fielding calls through that, is it calls to confirm the eligibility process, or does this also include calls to actually book the ride? Because if these are individuals that are getting reimbursement through the paratransit rides and are already eligible for paratransit services, are there, I want to go to wherever I'm going, and that trip is eligible for this subsidy, is there a reason why that call is not going through the Tri-Delta call center?
Yeah, Chairman Chuff,
They would be trained.
Yeah, go ahead, John.
Yeah, a good question. And we've had a number of meetings where we've developed the protocol on answering that very question, Rashida. So we have a fairly bright line between questions that are related to ADA paratransit sort of regulations and characteristics of the program, ADA paratransit eligibility, and then on the other side of that bright line is the fare subsidy program and how that program works, the benefits, the tickets, the programs. So Contra Costa Crisis Center is going to answer all of those, the fare subsidy program questions. And we have that set up. However, in terms of the ADA paratransit regulations and booking the rides, that is in, on the Tri-Delta side of the bright line. And that I guess, it makes sense, but it's also in response to working with Tri-Delta transit staff where they had concerns. They're running, the ADA paratransit program. And as I think most folks on this call know, that there are very specific parameters that ADA paratransit operates under, and we want the clients to get the information straight from the source, which is Tri-Delta Transit. I hope that answers your question, Rashida.
Yes, it does. Thank you very much.
And Peter, I see you've raised your hand. Go ahead, please.
Yeah, thank you, Chair Mitchoff. Everybody keep in mind that this is a means-based fare program. It's not providing service that's being provided by Tri-Delta Transit. And part of the operating cost, and I guess I'm saying bad on us for not defining this better, saying that this 20%, this $20,000 is admin cost. It's really not, because part of the operating cost of what 211 is doing is actually determining if somebody is eligible under their fare, under their income base to participate. And that's actually an operating cost, because the program itself is to determine who is eligible from an income base to participate. So we run into this all the time with transit operations, dispatch and road supervisors. Those are all operating costs, but they're not the driver, they're not the fuel, they're not, so keep that in mind when you're thinking about this $20,000. 211 has to provide the staff to actually do this extra step, which is a income determination. So in reality, that's part of the operating cost of this program and not an administrative cost.
Thank you, Peter. Mr. Tamara, can you address the concerns or the questions around training of the 211 staff and or volunteers?
Yeah, hi, everyone. Tom Tamura, I'm the executive director of the Contra Costa Crisis Center. I know many or some of you. So rather recently, I was approached by Peter and others, John and others, to say, would we be interested in doing this project? And just to let you know, I don't see this as a moneymaker for us. I'm interested, and our agency is interested for the primary reason that I think probably all of us know on this call is that identified by the customers and consumers in our communities, one of the greatest barriers to accessing services is transportation. And I've heard that in more than one meeting. I heard it from a number of people. So we believe that because of our easy access to 211, because people know about what we do for a variety of reasons. In addition, when people are calling us, we're also able to ask the second and third questions to be able to see if we can provide information resource referral to other needs that they may have in addition to their transportation needs. And this is something that we do 35 to 40,000 times a year. That many callers are calling us for those types of needs. In terms of the cost of, you know what, this is a pilot project. We have no idea what this is going to take on our end. We have an understanding of what it might take, but you know, because of the short timeline, my team and myself have been involved already to try to be a good partner and a thought partner in developing a strategy for this. And quite frankly, as a selfish side for me is I would like our 211 to be involved in, you know, having a coordinated entry role for transportation for the county, like we do for homeless services and others. To address the training issue for Debbie, absolutely, we will always are interested in getting more training. You know, and we routinely do it on a couple times to 3 times a month. We're having trainings from our community partners and agency partners on the services they provide, so we're able to understand what we do. We are, you know, currently we and for years have been intimately involved in different groups. So we work with AAA now. We answer the older adult, the hotline after hours, and on holidays we're taking those calls right now, and so as well as Child Protective Services, but we're APS calls as well. So yes, we want to learn more, but my understanding is that we're not a gatekeeper in terms of eligibility around the needs on the paratransit side. We are merely taking those, not the gatekeeper. So we'll take those referrals from paratransit and then do our income eligibility test or you know, eligibility evaluation at that point, and then do it from there. So, you know, I'll just say that we're proud to be here. I hope it makes sense to everybody here, and we're always open to learning and improving what we're doing. So we're grateful for at least the opportunity to be able to talk about it today.
Okay, thank you. I don't see any more hands raised. I have some questions and or comment. Oops, hit the wrong button. Hold on here. So should we approve this today? Does this then go to CCTA board because that's the fiduciary where everything is okay? John's shaking his head yes. So when would this officially or hopefully officially start?
We're looking at first quarter 2023 for
Okay.
the start.
And so that would give staff time to coordinate with those with super duper knowledge and Mr. Tamara's staff. You have great staff and they're super duper people too, but just to maybe share that information or additional information that might help those folks at 211. And I get that they're mostly doing the certification of the low income eligibility, and they're the ones passing out the tickets and they're answering questions on what the program is. But just to make sure that if there is a gap, it's closed. Okay. I'm doing some math here and tell me if I'm wrong, although now it went goofy. Okay. If 20,000 is going for operating admin, let's just say, oops, bring it back up. And that leaves 80,000 available for services. And this is a 6-month pilot. So 80, oh, I don't, Debbie, you think you're having technology problems. 80, 1, 2, 3 divided by 6 equals $13,333 a month, more or less. And where I'm going with this is the 22. So it comes down to about 600, a little over 600 people a month. Is the intent of this program to expand folks' ability to take paratransit. It's not really those that are currently using it, because that money's, well, there are, what I need is information to correct my perhaps incorrect assumptions. Not everybody riding paratransit needs a subsidy, but probably a great many of them do. But there are also maybe those out there who never have been able to access paratransit because of financial concerns. So this money will help not only those who are currently using paratransit and need this subsidy, but it could also expand the pool. Am I correct in that understanding, John and or Peter?
Yeah, Naomi, well, I guess you had some numbers questions in there, Chair Mitchoff, but you're correct in that, and this kind of goes back to Susanna's question earlier. One, this will enable existing paratransit riders who are extremely low income, where the fare is a barrier, that will allow them to travel more. We don't want to necessarily limit it to the existing population, so we are going to do some outreach outside the existing population as well. So it could expand the potential ridership.
So how, and this is, I was listening to those, that East County does need this. I'm thrilled it's going to be made available. How does that affect Tri-Delta's current paratransit capacity if there are now going to be potentially more riders?
Good question. I guess I will go back to a bit to Peter's earlier comment in that this is leveraging an existing program largely. We do anticipate some increase in demand. However, and this is why, one, we're calling this as a pilot, and why this pilot is a very narrow population, because we are being cautious about the potential latent demand that we're gonna release. And so again, the population is extremely low income and ADA paratransit eligible, which you have a small population, then a small population yet again on top of that. But yes, those are some of the questions that Tri-Delta staff raised as well. And they have concerns and we have concerns, and really it's the reason for this being a pilot. We're figuring it out as we go along, and it's why this is the 6-month pilot or the funding cap, whichever we hit first. And so it's constrained in a number of reasons, but one of the reasons is the issue you raised there, the potential increase in demand.
And Rashida, I see your hand up, but let me just make one other comment, and maybe you can answer this too. What happens at the end of the pilot? We're going to gather all this information and bring it back, but here we are, we've been able to provide this service. Do we have a plan for accessing additional funds, with my assumption that this is going to be wildly popular and we're going to want to continue providing that service? I don't know, Rashida, if you want to take that, or John, or you both can.
Yeah, we are going to do some post-processing after the pilot is over, look at the impact on ridership, on demand. And Naomi earlier suggested we're going to do some, interviews with the population to see exactly who is making use of the program. And so, yes, we are planning on expanding this. In the Measure X item that went to the Board of Supervisors, this package included $200,000 for fare subsidy program. So we have additional budget set aside to expand this program. And in the ATS plan, the fare subsidy is actually not just limited to ADA paratransit. We could potentially expand it beyond just ADA paratransit. So this is us dipping our toe in the water. And after the fact, we're going to look how to strategically expand it.
And I want to say we're actually going to be looking during as well. So
yeah, I saw that, the 3 months. I would, yeah, because I don't want to wait till the end of 6 months and say, okay, we know this is great, and now we got to go out and do it again. I'll leave it to you, but at 3 months, if it's doing and performing as we all hope it does, that plans are then put in place so that it doesn't end. Rashida, you want to address that, or did you have a different question? Because I have.
Yeah, I just wanted to add to that a little bit, because obviously when the original executive summary came out, or the HES plan itself came out, it was identified as a need. And the idea of doing a pilot was, how do we structure and how do we move forward with the need? We're going to have to come up with some kind of a plan to roll this out, hence the pilot. So the question now becomes, how do we measure the success of the pilot? Is it just the growth? Is it the fact that maybe out of 20 rides a day that TriDelta uses, or 20 passengers that they transport a day, we find out that 8 of them have made use of this particular program, or we find out that instead of transporting 20 rides a day, they are now transporting 30 rides a day as a result of this program. I mean, what are we going to use to determine the success of the program? And since it was originally identified as a need or a gap, a need and a gap.
Already successful because we're providing help to those that don't have it.
Exactly. So what long-term plans do we have once we identify that it's successful to keep it going, right? Because we want to go from pilot, just gives us, what it's going to take to get it done, get rid of all of the problems, work out all the glitches associated with it. But if we figure out how to identify its success, then what do we do for its long-term implementation so that it becomes a part of our transportation fabric?
Gotcha. Okay, thank you. Debbie, I see your hand up, but Diane's got her hand up and she hasn't asked a question. So Debbie, is your comment related to what this question or a new thing? Okay, she's shaking her head no. Diane, go ahead, please.
Yeah, so Rashidi's here, and he's TriDelta, and I just wanted to kind of bring him in, but I'm glad we're talking about it because it's helping us all understand that this is an experiment. And I love that Tom has the call center expertise. There's definitely some training and things that we can provide, but I think the goal is for this to be really big and to be county-wide, region-wide. We have this kind of thing. And so to think too small is, probably, limiting us. But I also think that, going too big is a little dangerous. So I would imagine that Rashidi, you guys probably, or we have, because I'm part of TriDelta as well, that we have kind of a plan of collecting data, and that's part of this whole program, so that we can, as Rashida was saying, kind of measure the success. And whatever else you want to say, Rashidi, I was just trying to open it up so that you could add your whatever 99 cents if you need to.
Yeah, it may be a nickel's worth since I just started a few months ago. So with that said, I in full transparency, I am catching up on this program. We are fully supportive of this program, and we look forward to seeing what it bears. I ultimately believe to Supervisor Burgess' statements that, free transportation is somewhere that the county is going to end up going in some version of it. So this allows for us to test those waters as a county. And it may be on a local level in with regards to it being in East County, but the data that's collected, I think, is going to be able to support what County Connection, for example, has been doing for years with the free 4 or 5, I think, and the 9 as well. So I'm looking forward to the opportunity. We have the resources today, but due to COVID, that may change tomorrow. These are real life issues that transit authorities are having and may continue to have as we move forward. So if we try to put this in a perfect world and have perfect solutions right now, it's not going to be able to do that. We all know that. So we have to dip our toe in the water, move forward, test it out. These are certified individuals that are already in our pool per se. So it's not like we're expanding our current operational pool. So we will be able to handle it, God willing. So
Well, no, and thank you that with all those financial caveats, we all understand that. But I think the biggest problem that we're all going to be facing is this is going to be, and I appreciate Rashida saying, how do you measure success? My concept is that more people will be able to use a system that they haven't been able to access, and that we need to find a way to keep it going forward. Debbie, you've got your hand up.
Yeah, in the same vein, just sort of like, what if it's a radical success and we figure that out in month 3? Like, I'm thinking about a conversation that I had with Vinay Pimple. I don't know if you guys are familiar with him. He was appointed Richmond City Council member for a few minutes. And anyway, we had he was a guest on Dishing with Debbie, and he talked about how when our transit started with the Uber subsidies, that it was life-changing for him. As a blind man, taking paratransit was a nightmare for him. It was totally inaccessible. And having Uber, which, for somebody who has a wheelchair, Carol was talking about, she's got a wait list of people who need wheelchair, they need that paratransit vehicle, but different disabilities, have different accessibility features and needs. And anyway, if we find out that it's radically changing lives and it's this really incredible thing, why couldn't we, increase the funding to it? And I agree 100% with Rashida in terms of the funding sustainability pathway. What does that look like? Because I do believe that everything that we are going to do, and I don't think we would start with something we didn't think was going to be successful, but I do believe that these, investments and these changes that we are making and thinking about, I appreciate the thinking of 211 and wanting to look at how this is going to grow, right? So how do we start in a way that we're going to be able to grow and scale and build? Like, all of this sounds and feels really fantastic. So I just wanted to share that rather than constraining, how do we make a possibility for if we do find out, because it could be that by month 2, we're hearing from every single human who is using this that it is life-changing. And in that case, we should be then saying, okay, we're not going to stop at 6 months, and we're going to figure out how we adapt. And maybe it's with the Measure X dollars that in that first year of funding. So if you'll recall, that first year was the year where it was OTO money that was going to the Area Agency on Aging, and a part of their priority was transportation. So maybe there's, because they have not gone out to RFP with that money yet, with that $1 million, maybe there's some of that money that can come into this space because it was identified for this kind of purpose. So I just saying there's a lot of possibility out there, and I would hate for us to overly constrain ourselves. That's all. Thank you.
Thank you. I'm not seeing any other hands raised. So Jackie, is there any public comment on this item?
No written public comment on this item.
Thank you. I'm looking for a motion and a second to refer this to the CCTA board. And I think I see, was that a hand, Supervisor Burgess?
Sure. Actually, I was trying to block the sun, but definitely, yes.
Okay, there we go.
Well, Haskew seconds.
Thank you. All right. Moved by Burgess, seconded by Haskew. Roll call vote, please.
Member Barnes?
Aye.
Member Burgess?
Yes.
Member Braxton? Member Franklin?
Aye.
Member Haskew?
Mute.
I know. Yes.
Thank you. Member Hudson?
Second. Oh,
Member
yes.
Hirsch? Member Hirsch? Member Kamara?
Yes.
Member Levin? Member McCrary?
Yes.
Member Meyer?
Yes.
Member Thompson? Member Toth?
Can I third it since Dave seconded it?
Sure. Thanks. Member Xavier?
Aye.
Vice Chair Geringer?
Aye.
Chair Mitchoff?
Yes.
Thank
Great.
you. Motion passes unanimously with members Braxton, Hirsch, Levin, and Thompson absent.
And thank you for all the excellent questions and the excellent staff work. I don't even think we have to say we have high hopes. We just know this is going to be fabulous. So our next item is an update on the one-seat ride expansion. This is informational only. John and or Peter, is this also with our wonderful folks from Nelson Nygaard?
Yeah, Chair Mitchoff, similar to the last item, the means-based fare item, I'll introduce this and then I'll hand it over to Nelson Nygaard to provide the details. So the one-seat ride program allows passengers to travel across transit jurisdictional boundaries without having to change vehicles. As I mentioned earlier, a pilot of this program was underway prior to the ATS plan, and it was started by Rashida Kamara and County Connection. And so while this quick sidebar, while the program did start in this county, it's actually being looked at for regional deployment by MTC, and I've even seen it referenced at the state level as a potential program for promotion there. So kudos to Rashida and County Connection for their vision on this program. The program has the promise to improve the customer experience, not having to transfer vehicles, and it also could potentially increase operator efficiency, not having to pull out 2 vehicles to affect a passenger transfer. The administration, funding, and scheduling of this program in the back end are actually rather complex, though, just due to the number of transit agencies we are working with. So Nelson Nygaard has been heading up that effort to sort of figure out the back end issues, and that is where I will turn it over to Naomi for the details.
Thank you. Let me share my screen again. Okay, can we see that?
Yes, we can.
Thank you. Okay, so I had hoped that a gentleman named David Kaufman, who's one of our senior principals, who's been doing a lot of work on this for us, be here today, but unfortunately he had another appointment, so I shall do my best. So I'd like to start off just by repeating some information about the existing program, since we are in really trying to build upon that and expand upon that. And we are so fortunate that the people who are operating this existing program are willing to work with us on expanding it. So the existing program has 4 participating agencies, transit agencies. County Connection, of course, are working with Tri-Delta Transit, WestCat, and Wheels, which is actually over the border in Alameda County in the Tri-Valley area.
Is that what LAVTA stands for?
LAVTA stands for Livermore Amador Valley Transit Agency or Authority, and everybody knows them as Wheels.
Okay, so Tri-Valley Wheels. Okay, thank you.
Yeah, it's just one of those.
Obviously not everybody, no offense.
No, people are like, Latvia, what is that? And I'm just like, it's Wheels. It is operated by County Connection through their contractor Transdev and their subcontractor Big Star. And the one-seat ride is a direct trip to a rider's final destination with no transfer required. Other passengers may be served along the way. The customer pays one fare, and it's based on who is the transit operator, where they are boarding. They're using one phone number for all the reservations for all the different transit agencies, and the current cost sharing is based on mileage of the trip that's in each operator's service area. So the total trips for a one-year period were 8,524, and you can see we have a graph about the share of cost, and also just a reminder about the participating agencies. So most of the trips are being done for County Connection and Tri-Delta Transit. And then a smaller amount for WestCat and LAFTA. So when we're talking about expanding it, we're looking at West Contra Costa County, which is the only part of the county that's not currently involved in the one-seat ride. We were thinking that there was a likely need for residents to travel to county-funded services outside of the East Bay Paratransit service area. Some of them are going into what is the East Bay Paratransit service area already in Richmond and El Cerrito and so on. We also had an initial assumption that it would benefit the existing East Bay Paratransit riders, potentially more than WestCat, but I'm not sure that that's actually true now that we've continued on. Madam Chair, I know there's a hand raised. I don't know if you want to take questions.
It's okay. Yeah, she'll wait. She's shaking.
Okay.
Thank you for noticing that.
Okay. So for the proposed expansion, and I want to say that, again, this is actually a very constrained proposal. We are, again, very much just proposing a small dipping of our toe in the water for a variety of reasons. We want to be cautious with this. So our proposal is to start with between the East Bay Paratransit and the WestCat areas. The current average existing transfer trips are 40 per month going from WestCat to East Bay Paratransit. And then for East Bay Paratransit to the WestCat area is 37 per month. So those are actually very close. Even though it's not their service area, the service would still be operated by County Connections contractor Transdev and their subcontractor Big Star. In our assumptions, David allowed for a 50% allowance for post-pandemic ridership growth since 21-22, and also 100% ridership growth for the OSR over a 12-month pilot versus the existing transfers. So based on his calculations, the initial cost per month on the WestCat side would be $514, and on the East Bay Paratransit side, $377. And this is a graph of that ridership growth. So a little under 60, going up to about 110 over a 12-month period from whenever we started. And then this is a projection of the operating cost over that time period. So the darker blue is the WestCat, and the turquoise more is the East Bay Paratransit. So it's a total, even with the rising projection in rides, the total for the WestCat is under 10,000, and the East Bay Paratransit is about 6,700. So that's our projection there. And so there's a lot. We've been meeting with all the operators, and there's a number of next steps still to be gone over. We need to continue to refine our demand and cost estimates. And we need to confirm the eligibility of our plans for the Measure X funding and the availability of sufficient funds. There is a match required for this, so we need to identify the source for that for each of the transit agencies. And we need internal approval by AC Transit and BART. We need to negotiate and execute an MOU, and then we have to get into really detailed implementation, such as client data, mapping, public information, and so on. So we've already set up the next meeting, and we have agreed within everybody who's meeting that we're just going to need to keep at it and keep scheduling these meetings regularly as we continue to hammer this out. So that's my update, and we're happy to take questions.
Okay, if you could stop share screen so I can see everybody. And so Debbie Toth, go ahead, please.
Thank you. Thanks for that presentation. So am I to understand that there's not going to be the West County part of that goes from West County to the Alameda? I'm not talking about Tri-Valley area. So I assume that your wheels is the Tri-Valley area, but there's not going to be that connectivity between West County into where hospitals and healthcare are delivered there in Alameda in the Berkeley, Oakland part.
Well, the people who are already in the East Bay Paratransit service area already have that connection. So, you know,
so they're already getting a 1-seat ride if they live in Richmond and they're going to Oakland.
Right. So, and then I believe, yeah, and so I believe that for people who are in the WestCat area, and WestCat does take people into some of the East Bay Paratransit service area already, so they might be able to transfer then. We may be looking in some cases, I think some of these trips that maybe were 2 transfers may become a 1 transfer. So there hopefully would still be an improvement. But as I said, it is a very limited pilot that we're proposing at this time. And I'd also like to note to the chair that Rob from WestCat has his hand up and might have better information than me.
Great, and I would like to understand the underlying root cause of why we're having a lack of participation in that West County area, or maybe it's just my perception and that's not the reality. I just feel like this is a double bang in this meeting to West County, because we are not doing the pilot of the first project in West County, and we're not now doing this in West County, or at least it feels that way. And maybe you can disabuse me of that. Rob, I'll let you take it away and correct me.
Well, I'm not going to comment on that part because I think that's between East Bay Paratransit and how we set that up. But I will say, to answer your first question, Debbie, even though you've walked away, but we do offer some trips directly into medical facilities in San Pablo and Richmond, which is kind of goes into the East Bay Paratransit service area. But if a resident of Hercules and Panola was having to access medical facilities in Oakland or Berkeley, they would still have to the transfer to East Bay Paratransit. So it would not be a 1-seat ride in that sense. So it kind of just depends on, we have expanded our service area into certain areas, in Richmond, San Paulo, as I say, but that's kind of the extent of it at the moment.
Okay, does that answer your question, Debbie? Yeah, okay. You're a come see, come saw person today. Rita, go ahead, please.
Okay. Well, I guess I have to wait for the future. And WestCat doesn't help people who live in Richmond and San Pablo and El Cerrito get to someplace else in the county. So there are a lot of seniors that are not signed up with East Bay Paratransit because they don't qualify. I've mentioned this several times. So I don't know when they're ever going to get help, including me, to get to Martinez or wherever we have to go for medical services, among other things. So I guess, like I said, I have to wait to see what happens in the future.
Okay, that's fair. John and our consultants, any comments based on what you've heard? No, okay. I have a question. Okay, it says on the 4th bullet on the last slide, it says, and my ears perked up, internal approval by AC Transit / BART. Does that come after we identify the source of matching funds, or are we working to get whatever approvals we need now?
Well, we're already working with the staff who would need to approve it on a staff level. And John, can you speak to the matching funds?
As far as the matching funds go, that, is at the discretion of each transit agency. As I mentioned earlier, the one seat ride program was running before the ATS plan or Measure X came available. So we know there is funding available for it. This Measure X funding coming online should just be a bonus, given that it was already funded program.
Okay, so I know I was looking back and forth. This is an informational item, but we're talking about an expansion. So I'm assuming the expansion has already been approved, or it was part of the original program. And now we're at that point where we can begin and or proceed with this expansion. Am I correct in that assumption?
I guess if we use the fare subsidy program as a model, we did a lot of work to figure out all the kinks and all the nuances. The one seat ride program is following behind the fare subsidy program because it is a much more complex program, and we are working through all of the complexities.
Okay, and that's fine. I just want to make sure as chair, when I saw that it was just informational, but then the crux seemed to be on the expansion, that you didn't need authority for that. Peter, you've got your hand up.
Yeah, thank you, Chair Mitchoff. Sorry, I keep popping in here because I feel like something needs to be said, but I'm sorry, I can't give solutions. They're very complex, and part of the complexity that I think needs to be said from the AC Transit BART perspective, which is East Bay Paratransit Consortium, when you talk about trips that occur in AC Transit's service area that are outside of Contra Costa, because AC Transit does serve both Contra Costa and Alameda County, is their ability to provide kind of these outside the ADA services, which is this one seat ride, and what that means from a district-wide perspective for them. So I think it can be worked out. I'm not saying it can't be. I'm just saying that's one of the complexities that occurs when we're having these discussions, that AC Transit is more than just Contra Costa. It also includes Alameda, and how are they, protect is not the right word, but how can they address services they provide to Contra Costa that they might not be able to provide to other Alameda, the other communities within their service district.
Okay, Debbie, did you want to make another comment? Go ahead, please.
I do. Thank you. I'm no longer driving, so I can lift and put down my hand timely. I again want to say that our conversation so often goes back to ADA and paratransit and the concept that the ADA is the ceiling. The ADA should be the absolute floor. And in talking about an accessible transportation strategic plan, we need to include the RITAs of the world. And so I just want to say it's clear to me, when we closed doctors' hospitals, we forced people in West Contra Costa to make a choice between taking a 2-part trip to Martinez or taking a 2-part trip to Alameda. And insurance coverage and doctors may have dictated where people landed. And we are not considering the human being in the way that we have designed our transportation system. So we need to do better. And if we are not going to have participation by AC Transit or whoever it is that's not participating, and my apologies if I'm getting it wrong, that there needs to be something else that we do in the absence of that. So maybe we pilot Go-Go Grandma in West Contra Costa to serve the not ADA population or something like that. I just say we need to have some sort of parity, and I feel like West County is getting kind of left out of things. I want East County included in things, don't get me wrong, but I just think we need to continue to ground ourselves in the continuum of aging and disability and recognizing that the ADA is not the ceiling, it's the floor. That's all. Thanks.
All righty. Thank you. Bob, Franklin, please.
Yes, thank you. Following along what Peter said, AC Transit also goes into Palo Alto, and BART serves 5 counties. We are participating in pilots with MTC on a regional level on this same topic. With that said, we are willing to negotiate and are looking to participate in this pilot.
Great, thank you very much. Rita, go ahead, please.
I just wanted to add something. There might be the misconception that the cities of Richmond, San Pablo, and El Cerrito that have their own paratransit service within a certain confined area, they can't go to Martinez. The cities do not provide services outside of a very constricted area. Thanks.
Okay, thank you very much. I am not seeing any other hands. Even though this is not an action item, do we have any public comment on it, Jackie?
No written public comment.
All righty. And so with that, we will now move on to our next item, which is also informational. And that is an update on the coordinating entity. And who's taking this one?
Thank you, Madam Chair. Ying Smith, Director of Mobility Programs for CCTA. So this is a very brief item. At your October 20th meeting, you approved a recommendation to the CCTA board for a CE structure framework as authority nonprofit partnership. We are moving this recommendation forward to the CCTA board at the December 21st meeting. During this time, we'll have many more conversations with our transit operators and other partners. We've done more homework. So the board agenda packet will be posted very soon today. So there's just additional information we have researched and provide and summarize. So just encourage you to look at the information and participate at the CCTA board decision making.
All right. And yes, there have been a number of conversations, and I'm sure some of you have been who are with our transit operators. There have been some concerns raised, and I know all staff have been working to address those. So Mr. Hale, is there anything else you wish to add? I know you've been working fast and furious to try and address some of these concerns. Not everybody at CCTA is aware, but this agency, I want to give you the opportunity to make any comments you wanted to make.
Yeah, thank you, Chair Mitchoff. And first, I want to appreciate everyone's support over the last several months, to finally get to this point. There, in full transparency, there has been, some concerns highlighted around the funding, particularly around CCTA, being designated as CTSA, and I completely understand the concern, because when CCTA becomes a CTSA, Consolidated Transportation Services Agency, it makes us eligible for funding that the transit operators are also eligible for as well, including TDA and STA funds. And so we have been working with the transit operators and as well as other stakeholders to address all of the concerns that have been brought to date. And in the staff report, as Ying mentioned, we're getting ready to bring the the coordinating entity item to the authority board based on the task force recommendation. And through that work and effort, the staff report is making commitments to not use TDA and STA funds for the coordinating entity, as well as making commitments that the allocations that are noted in the expenditure plan for Measure J will also stay whole. So this is consistent with the guiding principles that I think this group has set out, that no one has any intentions to, take funding away from other entities, and that the idea is that we would, really work together, similar to the discussion that we've been having in on the means-based fare subsidies pilot and the 1C ride. We're looking for additional funding to make these things, come to reality. So the staff report for the coordinating entity for the authority board, the packet will be posted. I'm hoping today. I'm actually doing the final review of the packet and the staff reports as we speak. And I'm looking forward to the discussion next week around the coordinating entity. Some of the other concerns that have been raised I think are valid concerns relative to authority of the coordinating entity, as well as the form and function of the coordinating entity. And so those are all things that will be continued to discuss after the board considers the item for establishing the framework and creating in concept this coordinating entity. And we'll continue to seek input from the authority board. And then that's essentially, marching orders and concerns that I think we collectively on this group have to work together to address as we continue to build out the framework. And so this is not the end of the discussion. This is the start of the discussion. And so there will be a lot of meetings, a lot of opportunities for all of us to work together and address everyone's concerns. I want to encourage everyone that as we continue to have these task force meetings, it's really important. I cannot stress this enough. It is really important that you raise your concerns at this meeting. Please don't be bashful. This is the time and the place to bring up these concerns, so that way we can address them as we continue to build out this framework, as well as the development of this coordinating entity. So I want to make sure we encourage that as moving forward with this group and future meetings.
Great. Any comments or questions on this update? Debbie.
Kara's like, oh my God, come on. I just want to thank you, Tim, and Karen, and all of you who have been working to ensure the progress of this moving forward. This is a really, really, really big deal for people who can't get where they need to go when they need to get there. Moving this forward and the work that's done in a transparent and open process where people who represent people with developmental disabilities, people with physical disabilities, people who are aging and have aging related chronic conditions, being part of the conversation, which historically has happened with just the transit providers and just in the context of paratransit and the ADA, is revolutionary, and it's going to change so many people's lives. And I just want to thank everybody. That's all.
Thank you. Are there any other comments or questions? Not seeing any. Okay, great. Then we will move on to our last item. This is an action item, approval of the Accessible Transportation Strategic Plan Task Force draft meeting schedule for 2023. Very important for all of you that have looked at it. It is in your report. Go ahead. I was just going to ask if anybody has any comments or questions. Would someone like to move the adoption of the meeting schedule for 2023?
I'm happy to move it forward to be bi-monthly, beginning on the second Thursday of the month, the beginning on February 9th.
I second.
And we've been meeting quarterly. There's been so many. Okay.
Bi-monthly.
That's what I thought. So we're going to continue that schedule. All right. So moved by Geringer. Do I have a second?
I second. Xavier.
Thank you, Xavier. Seconds. Public comment, please.
No written public comment received.
All righty. Roll call vote, please.
Member Barnes?
Aye.
Member Burgess?
Aye.
Member Braxton? Member Franklin?
Aye.
Member Haskew?
Aye.
Member Hudson?
Yes.
Member Hirsch? Member Kamara?
Yes.
Member Levin, Member McCrary,
Yes.
Member Meyer.
Yes.
Thank you. Member Thompson,
Yes.
Member Toth,
Yes.
Member Xavier,
Aye.
Vice Chair Geringer,
Aye.
Chair Mitchoff.
Yes.
Thank you. Motion passes unanimously with members Braxton, Hirsch, and Levin absent.
All right. And with that, and he doesn't know I'm going to do this, but Mr. Engel has decided to retire, and there is a celebration of that retirement this evening. Peter, I'm sorry, I'm not going to be able to be there. Not feeling really bad, but getting a little nervous because my colleague has COVID, and I know you've had COVID, and I've had a cough, and I'm sitting here like grandma with a Afghan around my shoulders because I'm cold. So I want to wish you a wonderful event tonight. I want to thank you for all the work you've done on behalf of not only this this entity, but your many years with the authority, and that even all the work you've done in transportation that has preceded that. You've been such a great person to work with. And I'm sure you'll hear many accolades tonight. But first of all, I wanted to give my accolades. Second of all, I wanted to make sure you all knew about this big wing dango at the Stadium Pub. And you can't use the excuse that you want to see the 49ers because they will be on TV there. And so that's another reason to go, because this is a big game tonight, folks, a big game. And so thank you, Peter, for putting your party on this evening. Is there anyone else who'd like to make some wonderful comments about Mr. Engel?
No,
Oh, come
Tim
on,
needs to
Bo.
clarify a bunch of stuff here.
Okay, what have I done wrong? Or what did I not say right?
Yeah, Tim, you tell her.
The party is at Massays in Walnut Creek, number one.
Oh, well, the one I got forwarded said that. So at Matt Say's, okay.
What else am I supposed to clarify?
5:30, Massays. Tim said he's buying everybody's first drink. I am bringing homemade banana bourbon glazed pecan shorty cookies made by my husband with a little sous chefing support from me. And I think everybody needs to go because Peter has been the most incredible human being, hard worker at CCTA, behind the scenes, gets zero credit, and he deserves to have people clinking glasses and celebrating him. So this is just my plea for you all to show up because I'm going to talk a lot more tonight.
Thank you.
It's all right.
Rita, go ahead, please.
Well, I wish I could be there. Peter, I'm going to miss you. I've known you for, I guess, quite a long time now. So I know everybody's going to miss you. And have a happy retirement. But don't just watch TV on the couch.
You can do whatever you want, Peter. You just don't have to tell us.
Yeah, and Peter, remember, Teresa's the chair, so come back for public comment.
Thank you, Rita. Teresa?
I just want to say that actually I have another commitment, but I know that I will see you before the end of the year. But I appreciate, Peter, your sense of humor, and you get all kinds of things done, but you do it in a way that is humble, sort of quietly, as Debbie said, behind the scenes, and but with a, as friends say in Boston, wicked sense of humor. And so I just really appreciate that and hope that you get to do, as Karen said, whatever you want, but lots of outdoor activities and fun, and don't look back. Well, look back. You should come back and have lunch and breakfast and stuff with us sometimes.
Oh, yeah. No, all former
Thank you.
folks are always invited.
Yeah.
All right. Well, with that, then we are
Wait,
going. Go
Wait,
ahead.
one thing.
Can I say something?
We gotta say one more thing.
I missed.
Okay, go, Tim, go first.
I
Well,
didn't see a hand.
sorry, I didn't raise my hand. I
Oh,
apologize.
all right. Okay, Tim.
But yeah, I mean, Peter, thank you so much for your leadership on this particular area, the topic of accessible transportation. And, with you and John, we would not be able to get, where we're at today. And So I really appreciate you, brother. And then also I want to thank Supervisor Karen Mitchoff for her leadership. This is her last meeting on the task force, and her last meeting at the authority board is actually next week. So we would not be here today without her leadership and really taking this topic very, very close to her heart and getting things done and making the progress that we've have over the last several years with the Accessible Transportation Strategic Plan and the implementation of that and the pilot projects that we've been talking about today and really making a difference. So I really want to express my appreciation for Supervisor Mitchoff's leadership and just passion in this topic.
Well, thank you, Tim, because for once, I think I've recovered. I'm not crying. Everybody, for the last few days, all I do is cry. Every time somebody says somebody nice about me. Well, good, Peter. These are tears of joy and tears of, well, I don't know what, but if any of you read Leonard Pitts, he's an op-ed person that appears in the East Bay Times. He's out of the Miami Herald. He wrote his retirement column today. And he had the bravery to say what at least I will say. He's emotionally exhausted, and I think a lot of you in public service understand what that means. And I thank you for your kind remarks, Tim. And it doesn't mean we don't want to continue doing the work, but there are others that have the energy that this requires. And I'll be in the background. I'm not going anywhere. I've made commitments to folks, and I'm looking forward to that. But you've got Supervisor Burgess from the board here, and I'm pretty sure you're going to have Supervisor-elect, I need to say, Carlson coming on board, and Debbie has done her part, and you're all welcome to continue pounding on him, and he knows it, about the needs for these types of services to serve our population that needs our help. So with that, everybody have a lovely time. Oh, Peter, are you raising your hand? Or
yeah, no, I was raising my hand. I just wanted to say I know you want to.
No. This is for you. I don't.
Real quick, 16 years. And I look at this picture in front of me right now of all these people, electeds, stakeholder, NGOs, all these stakeholders, transit operators. This is where I wanted to get. I mean, I wish we were more forward than we are right now after 16 years, but I can retire knowing, wow, this group of people is going to get this stuff done. And it makes me so happy. And I really appreciate all the effort that everybody's putting into this. And thank you, Tim, for making this a priority for CCTA. It is a priority, and we need to move this forward. And Karen, I wish I could virtually hold your hand right now as we move into retirement.
Well, are you going to be there next Wednesday, or you're already out the door?
No, I'll be there Wednesday.
Well, good. We'll do that then.
We'll be a big hug.
Yes.
Okay.
Good.
Thank you all.
Thank you.
Love you. Keep it moving forward.